Okay, so I just want to go over peripheral artery disease one more time because I didn't like it the last time. Anyway, so peripheral artery disease, the causes like coronary artery disease, the risk factors for peripheral artery disease can also be grouped into two main groups: the irreversible and reversible risk factors. Irreversible, again, age and family history. The reversible ones are diabetes, smoking, hypertension, hyperlipidemia, and atherosclerosis. How are these risk factors? Because each one of them scars the blood vessel in its own way. Diabetes makes the blood really thick, so it moves slower, and it puts, more. It causes more the blood vessel to work harder. Smoking, because smoking scars the blood vessel lining. Hypertension. Increased pressure is never good. Hyperlipidemia, because it causes the cholesterol to stick to the blood vessel and accumulate, leading to plaque and eventually to atherosclerosis, which is hardening of the blood vessel. So in the pathophysiology, how do these lead to that? Like I just said, this is your blood vessel, right? And the hardening, let's say it's happening here somewhere, there is a narrowing of the blood vessel. All of these things have caused scarring and narrowing of the blood vessel. So it's an organic. Why it's an organic change? Because all of these things are happening from the inside. It's kind of intrinsic, so to speak. It's happening from the inside, causing a structural change. Because this is not normal. This is a structural change. It's not a functional change, right? Causing a fatty buildup, then leading to inflammation and causing a blockage in the blood flow. Because if you have your blood flowing this way and then you have this narrowing right here, so only one can move, so this essentially would lead to hypoperfusion, right? Hypoperfusion. And if left untreated, it can eventually lead to ischemia. And then again, if left untreated, it can go ahead and lead to necrosis or death of the tissue from lack of oxygen. So hypoperfusion, hypoxia, ischemia, and then necrosis or gangrene. So all of these lead to a peripheral artery disease. Peripheral because it's away from the brain and the heart. It's somewhere else, far away from the brain and the heart. So it's a peripheral. How does it present? For the most part, it's asymptomatic, like coronary artery disease. At the beginning, it's asymptomatic because the blood can still go through. So there might not be that much pain that is noticeable enough to come to the doctor's office. But in case it's progressed, it can present as a number of things like intermittent claudication and limb ischemia, acute as well as chronic, gangrene and necrosis in the very late stages. Now these right here, we call them presentations, but honestly they can be better described as types, because each one of them has its own causes, its own presentation, its own management, its own everything. It's like it's a peripheral artery disease type rather than presentation. I will go over it. I will go over it right now before I continue. So intermittent claudication, I said each one of them has a different cause, right? So in intermittent claudication, the cause is peripheral artery disease. So the person will have a history of peripheral artery disease. And so in chronic limb ischemia. However, in acute limb ischemia, the cause is totally different. The patient or the person will not have a peripheral artery disease history necessarily. So again, they might not have a history of peripheral artery disease. They may, the cause for their limb ischemia could be embolization, thrombosis, or direct trauma. It's not necessarily peripheral artery disease, but it presents as such, and the trauma is to the artery, so we consider it as an artery disease. even though there's no history of it. And that is why it's acute. Because if it wasn't acute, it would be chronic. This is sudden. Which brings me to my next point, which is pain. So in acute limb ischemia, it's sudden. It is a sudden, sharp pain all over the limb. All over it. And there will be no relieving factor whatsoever. Which also makes the limb indisposed. The patient won't be able to use their leg at all, which makes it a vascular emergency. Acute limb ischemia is a vascular emergency. On the flip side, in intermittent claudication, the pain is only on exertion, like walking up 5 flights of stairs or like walking a certain distance. So on exertion, the patient will start to feel pain. Location could be anywhere in the lower limb. It can be in the calf, in the foot, in the toes, in the buttock, anywhere. It gets relieved with rest. This is key. Right here, it gets relieved with rest, usually within 10 minutes. Is the limb indisposed? No, the patient can still walk. The person can still walk, can still use their limb. It hurts. It just means they have to have frequent rest, but they can still walk fine. In between is the chronic limb ischemia. Chronic limb ischemia is in between, so the pain is occurs even at rest, on exertion and at rest. It's constant, it's consistent, and it happens mostly in the foot. See, here we said anywhere. It can be anywhere. Here it's all over, but in the chronic type is mostly in the foot. And how does it get better? By hanging the foot off the bed. Now this sounds paradoxical, but it actually makes perfect sense if you think about it. This is an arterial disease, right? So artery is basically blood moving away from the heart and to the limb. So if your foot has low blood perfusion or low perfusion, what you need to do is just put it down, let the gravity do its job, and pull the blood down toward your foot. This is why you hang it off the bed and your symptoms are relieved. So it makes perfect sense. Is the leg indisposed? Not really, but sometimes the pain can be so hard that the patient can't use their leg, but for the most part they can still use it. I will go through investigation and then come back for management. So investigation, of course, you have to take history and physical examination. Physical examination, why physical examination is important? Because you have to assess temperature, pulses, and all of that. It's important. Why is it important? Should I go through it now? The physical exam? No, I'll go through it in a minute. And then we have the special tests, non-invasive and invasive ones. Oh, okay, this makes no sense like that. I need to... I'll come to it in a minute. Anyway, so invasive and non-invasive. The non-invasive is the ankle brachial index. It's not very specific to this, but it gives you an idea, so you can work right away or like make your decision faster because it's fast. And as I said, non-invasive, so it can happen real quickly in the clinical setting. You just have to assess the ankle and the brachial pulse and pressure. If the calculation is less than 0.90, that is 90, then that is a positive test for peripheral artery disease, and you can go forward and use anything else like a segmental Doppler, duplex ultrasound, but the golden standard here is CT angiography. Okay, so you have assessed, you have diagnosed, and now you want to manage. Let's go back to management. So in intermittent claudication, your main goal in the management is symptom relief. Okay, that is not what I want. It's symptom relief. So there are two types of symptom relief in intermittent claudication: surgical and non-surgical. Surgical is basically your very last resort when it comes to intermittent claudication. It's not the first thing you should think of. It's not the first thing that your mind should go through. It is only advisable or indicated for class 1 recommendation patients only. Only. Otherwise, you go for the non-surgical. You can advise simple exercise. Exercise is, for the most part, extremely effective. Exercise can be something as simple as walking. It doesn't have to be anything fancy or exhausting. Walking can do the trick. Because it can get the blood moving, and if the blood keeps moving, then the limb is in the safe zone, so to speak. It can also be pharmacological intervention like silostazole and pentoxifylline, if need be. These things are good because they are vasodilators, if I'm not mistaken, so they keep the blood moving down to the limb. In the chronic limb ischemia, the goal here is limb survival. Because chronic limb ischemia, as the name suggests, it's chronic ischemia. So, like I said, ischemia, if not treated, can go on and become necrosis, right? And gangrene. So you want to make sure this doesn't happen. So your goal should be limb survival. So there is not really a pharmacological or non-surgical intervention for this, but the non-surgical interventions, so to speak, are just so it doesn't progress. So it's wound care and antibiotic. Both of these are for to keep the limb from getting infection, or to keep the infection from manifesting further and infesting into something ugly like gangrene. So for the most part, the treatment here is surgical by bypass grafting the artery itself. Or sometimes what can also work here is stenting, which is what we talked about previously in coronary artery disease. Stenting can work here also, like it can be a life-saving or a limb-saving intervention. And if worst comes to worst, then I'm sorry to say, but amputation might just be your last resort. In acute limb ischemia, like I said earlier, it's a vascular emergency. It is a big deal, huge deal. So you admit the inpatient, and you start them on thrombolytics, full dose heparin, and a thrombolytic like urokinase, alteplase, any kind of ACE that is a thrombolytic, you put them on. And then you perform a surgery, embolectomy, and urgent bypass right away. This is extremely important, otherwise you will lose the limb. And worse yet, the patient themselves might completely die. Not just their limb will die, but them as a person will die. The 6 P's are very famous here. The very famous 6 P's are the pulse, the presentation. Limb will be pulseless. There will be pain, pallor, polychylothermia. Oh, this is the Y and the I are flipped. Anyway, so it's very cold, paresthesia, and paralysis. Paresthesia is, tingling and numbness of the limb in this case, and paralysis. Paralysis, which means they cannot move it. It's right here. I got lost. Paralysis is why they cannot move it and the limb is indisposed. Okay, so this was peripheral artery disease. Okay, we have gotten over everything. That is great.